We do You Ask, We Answer every week, usually on Fridays with Trinity Health of New England's Dr. Syed Hussain, but he's joining us today on Thursday, and we are thankful for his time and his expertise. Doctor, good morning. How are you today?
Morning. I'm great, thank you.
Glad to have you in. And we are going to start with a viewer question. Gary wrote in to ask about the difference between sort of vaccine-induced immunity versus the immunity you get from getting the virus itself. He wrote in, out of our 4-member household, 3 of us are fully vaccinated. My 24-year-old son, though, has avoided the vaccine because he says he's a COVID survivor and a firm believer that his antibodies will protect him, maybe even more so than having gotten the vaccine. The question is there any validity to this claim?
Hi, thank you for the question. So, Gary, your son needs to get vaccinated is the bottom line. If you look at data that the CDC has published, that's put out there, if you look at numerous studies, there's a higher risk, actually twice as likely to get reinfected for someone who's recovered from COVID-19 if they do not get vaccinated. So the protection conferred from natural infection varies from individual to individual. We've seen cases now coming out from South Africa where people went through infections through Delta and other variants and now getting reinfected with Omicron. So bottom line is that your son definitely needs to get vaccinated in order to be fully protected for himself and for all of them.
And it should be pointed out, you don't have to have a false choice. You don't have to pick one or the other. If you've been infected, yes, still get vaccinated. All right, doctor, also a good time now, people starting to plan those Christmas trips. What are the safety precautions they should be taking at this point based on where we are?
So let's go through this scenario. So 3 important things folks need to remember. First thing, vaccination, vaccination, vaccination. So is everybody fully vaccinated and or appropriately boosted in your gathering? If the answer is yes, then feel free to spend time with those loved ones, family members. There's a very minimal risk of infection. It's never zero, but it's very, very low. That's the best safe environment that you can be in. Now, if there's someone who is not vaccinated, then it becomes more trickier. And I wouldn't, given what we're going through right now across the country, that's not something that's advisable. Now, number 2, there are rapid point of care home testing now available. So that adds another layer of protection. So before getting into a gathering, it would make sense if everybody gets tested just to ensure that folks are negative. And third thing, if you're in an indoor space, especially now during winter, please wear a mask. That includes gyms, supermarkets, malls. We already wear a mask if we're traveling. It's the right thing to do.
All right. And once again, every week, want to ask you for this update on the Omicron variant, getting so much attention. And it looks like, okay, we're starting to see more real world evidence that it's more transmissible because it's becoming a bigger percentage of the positive cases here in Connecticut. Yale New Haven Health said maybe up to 10% at this point. But it's the severity. We're seeing so much anecdotal data, preliminary data, that even more than other variants, most of these cases are turning out to be mild. I want that to be good news, but I just don't know where we are with that. Where are we, Doctor?
So I don't want folks to become complacent. At the same time, we don't want to add to their already anxious state, but it's too early to say whether it indeed causes less severity or more severity. So the coming weeks will tell us for sure. What we do know, though, is it is, to your point, highly transmissible. So if the number of infections rises exponentially, that will translate, a certain percentage will translate into hospitalizations. And keep in mind, healthcare workers, hospitals, healthcare systems in this country, around the world have been going through this for almost 2 years. Folks are burnt out. Folks are tired. So keep all of that in mind as you approach the holiday season. Keep those healthcare workers, healthcare heroes in mind as well, because ultimately we want to make sure that everybody's well-being is kept in mind. So please practice public health measures. And if you know folks who are not vaccinated, they need to get vaccinated and or boosted.
Okay, Dr. Hussain, thank you so much for taking the time to join us once again for another edition of You Ask, We Answer, spreading some knowledge. We do always appreciate it.
Thank you.
I'm glad to have you again.